Keaton Schfelker, and I'm going to be talking to you guys about osteoporosis today. So first off, I want to see what you guys already know about osteoporosis. Anybody?
Well, I am aware that it's a problem with bones and that they weaken, and when you have that type of a problem, then you have more of a chance of having broken bones, especially as you get older.
Anybody else know anything else?
And all I know is it has something to do with bones.
All right, so that is pretty much exactly what osteoporosis is. So, osteoporosis is a condition that can be serious, and it's caused by loss in bone density. So it decreases the strength and makes the bones very fragile, which can cause them to break easier. It's often silent and goes unnoticed until you do have a fracture, and that's when osteoporosis is most often diagnosed. Osteopenia is the stage that's before osteoporosis, so you have some bone loss, but you're not to the point where they're super fragile and break very easily yet. So the facts about osteoporosis. More than 53 million people have either been diagnosed with osteoporosis or are high risk for osteoporosis without knowing it. Both men and women can be diagnosed with osteoporosis, which not a whole lot of people know. They think it's just a disease that women get. People that are over the age of 50 and women that have been through menopause are at risk for osteoporosis, and white and Asian women are at the highest risk for developing osteoporosis. There are certain illnesses and medications that do contribute to osteoporosis. Some of the big ones are long-term steroid use, and there's different hormones that do contribute to it. Autoimmune diseases, different gastrointestinal diseases, endocrine, blood, neurological, mental illness, cancer, and HIV and AIDS can all contribute to osteoporosis as well. And osteoporosis can be genetic. So that's one thing that most people don't know as well. So if someone in your family has it, you can also be at a higher risk.
So Dad, you said that your mom has it, correct?
Right.
So that means that you can be at a higher risk for osteoporosis. So osteoporosis and osteopenia is a process where the osteoclasts in your bone, which osteoclasts helps to clean, work faster than the osteoblasts, which help to build new bone. So that causes the bone to demineralize and go away, making it more fragile, and the osteoblasts can't keep up and help build new bone as quickly. So osteoporosis can be diagnosed in a number of ways. So like I said, most often osteoporosis is diagnosed after somebody has had a fracture. But there are other ways that it can be diagnosed. Osteoporosis a lot of times will be caught if somebody starts having back pain, which can be caused by a fracture in your vertebrae. If you have a stooped posture and loss of height, that also could mean that you have osteoporosis. So most often it's diagnosed with a DEXA scan, which I will show you what that is. Basically it just scans your bones, your wrists, your hips, and your spine, and it takes about 15 minutes, and it just looks at the density of your bones and helps determine your risk for osteoporosis or if you have it already. And the fractures that I was talking about, one of the main ones is called a fragility fracture, and that's when you're over 50 and you are standing and you were to fall and you break a bone. You shouldn't break a bone just by falling down, so that's one of the major things that helps diagnose osteoporosis. So I don't know if you guys can see, this is a DEXA scan, so it's basically just you lay on a table and it's flat open, and there's one little thing that comes over you and it scans you. So basically it'll just scan the bone and it'll show areas where the bone is breaking down, and it'll give a score that then helps determine what your score is. So osteoporosis is a score of negative 2.5 or greater. Normal bone is negative 1.0. Like anything above negative 1.0 is normal bone. So people who should be screened for osteoporosis, anyone over the age of 50 is at a greater risk for osteoporosis. Obviously, postmenopausal women, anybody who started having a loss in height, and then obviously I said cancer patients are at a higher risk also for osteoporosis due to chemotherapy. So what I was kind of talking about, osteopenia versus osteoporosis. So I already said that osteopenia is a partial loss in bone density. So like I said, normal bone is a score that is greater than negative 1.0 on the DEXA scan. So osteopenia is when you're negative 1.0 to negative 2.5. So that's a pretty big gap to catch where you're starting to lose bone, but you're not to that osteoporosis factor yet where it's really dangerous if you were to break a bone. Osteopenia is treated with medications and lifestyle changes such as exercise, changes in your diet, and things like that. Osteoporosis is the loss of bone density, and it can be dangerous. So you're more likely to break a bone, and if you do break a bone, there are complications that can actually kill 1 in 4 women in the first year. So it can be pretty scary. And osteoporosis is a DEXA score of I wrote that wrong. It's greater than negative 2.5. And osteoporosis will have the same treatment as osteopenia with added medications to help regenerate bone. So here's the stages. So this is what normal bone should look like. Osteopenia, you can see here, it's the holes in your bone have started to expand, so there's not as much there, making it more fragile. And then osteoporosis, you can tell a lot of the bone is gone. So you don't have much there. So actually with osteoporosis, you can sneeze, bend, twist, pretty much do anything and break a bone. So like I was kind of already saying, osteopenia. One of the main things that you have to watch with osteopenia and osteoporosis is lab work. So vitamin D, calcium, and magnesium are all labs that will be checked after you have a DEXA scan to see. Vitamin D and calcium, if you are low in those, can also obviously predispose you to getting osteopenia and osteoporosis. So you check those and determine if replacement is needed. So if levels of vitamin D and calcium are low, you can give over-the-counter of those medications and also add those into your diet. So try and get more yogurt in, take some over-the-counter vitamin D pills, recheck your lab work and see if that helps. If that does not help get your levels up, then it might be needed where you need a prescription of these medications to help keep your levels in the target range to keep your bones where we want them and keep them healthy. So labs then are checked pretty frequently, and most of the time it's every 6 months just to monitor and make sure that everything's going okay. And then with osteopenia, you have a DEXA scan that we talked about every 2 years, just to repeat and see. And the only thing that would change that is if you do have a fracture like we talked about from a standing height fall, because that will automatically diagnose you with osteoporosis. And like I said already, exercise is recommended with osteopenia and osteoporosis to help strengthen bones. And then osteoporosis. So like I said, still the same treatment with calcium and vitamin D. And then there are a lot of different medications that are specifically designed for osteoporosis to help with rebuilding bone or stopping the osteoclast from cleaning all that bone away and helping keep the bone where we need it. So labs are checked every 6 months or sooner if you're not responding to the vitamin D and calcium, to play and kind of make sure we get your levels in that target range like I talked about. And then you get a DEXA scan every year with osteoporosis.
I wondered why magnesium was not on the list there with calcium and vitamin D, and it was mentioned as a test to be done on the previous slide.
Yeah, so magnesium can contribute to osteoporosis, but calcium and vitamin D are two of the bigger ones.
Okay.
So those are the ones that more often you see that the level is off and you need to replace those.
Okay. It was a magnesium that a nurse told my mom she should be taking magnesium. I don't know, is it 1,000 or 500 milligrams?
Yeah, and magnesium sometimes does need to be replaced, but more often it's calcium and vitamin D. So.
Okay.
All right, so I talked about there's different types of medications that can be used. So one of them is the bisphosphonates, which is a class of drugs that are used that, like I said, they stop those osteoclasts from cleaning all the good bone away. So they stop that and then make it easier for that new bone to be built by the osteoblasts, which helps strengthen your bone and help stop osteoporosis. So they can be given either by IV or by mouth. Some of the downfalls of these are that they cause a lot of problems with GI irritation. So you have to take these medications on an empty stomach and you have to remain upright for at least 30 minutes afterwards. Otherwise, it can cause a lot of irritation to your esophagus if you were to lay down after taking them. And another bad thing, these can only be used for 3 years. So if you've taken one for 3 years, you're completely done with this class of drugs and you have to move on to something else.
What would happen if you took more than 3 years of that?
I think they just aren't effective after 3 years.
Mm-hmm.
So basically, you get your 3 years and they are, like I said, hard on your stomach. So it can cause that problem and then they're not going to be as effective.
Okay.
And some common ones that you may know are Fosamax. Boniva is a big one that you see the commercials for on TV. Actimel, and then also Reclast, which, like I said, that's named after the osteoclast to kind of stop it and rebuild bone. And then this is a newer one that's on the market within the last 5 years, I think. It's called Prolia. It's a rank inhibitor. So the way these work is they reduce bone resorption, so it stops those osteoclasts from working, kind of like the bisphosphonates do. And this one actually allows more bone to be built than the bisphosphonates do. So Prolia, it's an injection that is given subcutaneously, so into the fat of your arm back here, and you get it every 6 months. It's one that was designed for cancer patients and patients that have altered kidney function and are on dialysis, so it's a safe drug, really good drug. Another thing that I did not add on here is for women, if they're on it, it helps the BRCA1 gene, which contributes to breast cancer. It helps suppress that. So that's another plus side of this, is it can help stop breast cancer in some women. So the only reason you could not take Prolia is if you have the low calcium level, which is why we check the labs so often. If your calcium level's low, then you cannot get the Prolia injection, and you would have to get that level up in order to take that. And this is all my references, so now I'll open this up for any questions that you guys have.
Is it ever where you get to the point where you can't build bones anymore, and then so that it's irreversible?
With medication, there is always the chance to build new bones. So there can be a point that you get to where you're kind of just at a standstill and you're not losing, but you're not gaining new bone. Mm-hmm. So you're just kind of at that good level that we want you at with some medication, but that's normally after years and years of treatment.
Okay.
So like if you have family members with autoimmune diseases, you know, you should be encouraging them to be checked.
Yep. I would encourage anybody who's got autoimmune diseases, cancer, anybody who's been on steroids for multiple uses or for long periods of time, because that can contribute